All right, part 3. All right, for this one, we're going to be talking about Corona polishing products and the techniques. So the meat and potatoes of what you're going to be doing. Um, I think that we should have a contest when you guys come in to see like who can name off all of the flavors that you guys have in your office. But if you only have like 2 or 3, then that doesn't count. We need like laundry lists. I don't think that I could tell you all of the flavors that we used to have in my office, but it's just crazy how many options there really are. So I'm just kidding. We don't have to have a contest. I just think that would be fun. All right, here we go. So when talking about polishing pastes, the majority of the paste itself is made up of that abrasive product. So 50 to 60% is the abrasive ness. And so when you feel it, it feels coarse, similar to like those exfoliants that we talked about in the previous lecture. And then the majority of the rest of it is things that like bind it together and add moisture. So um, of course, they also have like all of the flavors that I was just talking about, colorings, anything that makes it smell good, taste good, all of the things. The abrasive product itself, most of the time we see pumice, but there are some other options. And so some of those are listed here. That Silex is this first one here, that is an abrasive that can be like sprayed. So in like a Profi Jet, for example, calcium carbonate is basically like chalk, and that tin oxide is great for like metallic restorations. There are, as I have discussed in the past, different particle sizes, so different grits. So we have fine grit, medium grit, coarse grit. Um, as I have kind of discussed, it's really important to use fine grit whenever possible. There is a time and a place for coarse grit when somebody has really heavy stain, but unfortunately, the majority of what is being sold in the world, like 80%, is coarse grit. And so that's just really not needed for the majority of our patients. Most patients can be effectively removing of the plaque and stain using that fine grit paste. So please, 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 anytime you can, really try to utilize that fine grit. And if you're responsible for the ordering, try to kind of encourage others in your office to use that fine grit and start purchasing more of that. Tons of different brands, flavors, looks, feels, all the different things. None of them are right, none of them are wrong. It's just really trying to focus on the fine grit and then whatever flavors most of your people like. As I have also said, some pastes have additives to them, so that can allow them to be effective in other ways, minus just an aesthetic process, So fluoride or the CPP, ACP, both of those kind of help to remineralize or reinforce the enamel. So that is a therapeutic benefit of that specific polishing paste. And then the Pro Argin is it has desensitizing technology, so it kind of occludes the dentin tubules, preventing the fluids from, kind of fluctuating back and forth through the tubules, causing that sensitivity. So this product blocks those dentin tubules to decrease sensitivity. There's multiple different kinds of Profi angles. Most of them are disposable, as you can see here on the right side of the screen. But, if you're environmentally conscious, then you can also get reusable ones that are metal, and then you just, an autoclavable, and you just pop the little Profi cup on and like off and throw that part away. But the rest of it is reusable and autoclavable. If you get those reusable ones, then the Profi cups themselves look like this. So that kind of looks like a latch head burr that you might see, with your restorative, kits or whatever. But all the rest of these are disposable type tips. And so you can see a huge variety. There are some that are cupped, some that are pointed, some that are ribbed on the inside, ribbed on the outside, smooth, all kinds of things. Like I said before, if your patient has a latex allergy, make sure that you're using non-latex cups because there are latex cups. The cups that have a lot of those like ribbing inside will hold that polishing paste a little bit longer, like so then your stain removal is a little bit better. Some of these are a little firmer, some of them are a little bit softer. So depending on that might tell you how much pressure you should apply or not apply. They also come in a variety of different sizes. So there's like a standard size and length, and some that are shorter and some that are longer. This one here is actually kind of like a 2-in-1 where you can use the polishing cup. And then if you needed to, you could pop that cup off, and then you have this little point that you can kind of get into all the nooks and crannies, mainly in the occlusal surface. Um, they also have these like various different shapes, some that have the polishing paste like embedded into the cup, which is, that's kind of nice. One less thing that you have to buy. You don't have to take the time to like scoop up the paste and then go back over to the mouth. So pros and cons, usually these are a little bit firmer, so you just should be careful again with how much pressure you're utilizing. Also, there are Profi brushes, and these are great for staining the occlusal surfaces or kind of to work around the orthodontic brackets. There are like these flat tipped brushes and then these tapered brushes. I like the tapered brushes a lot better, but there's benefits to using both. With these, you just really, really, really want to make sure that you're steering clear of the gingival margin, because that can they're pretty stiff, and that can really cause some damage. So just make sure that you're steering clear of that. There are cordless, I almost said electric. There are cordless hand pieces that you can get and utilize for coronal polishing. These are usually like lighter weight. They kind of like balance in your arm, or in your hand rather, a little quieter, and sometimes they can be more efficient because you're not having to like deal with the cord, and you can kind of move them around a little easier. So those are a bunch of pros, but kind of a con of this is that probably in most offices, you are using a polishing like piece, a connector that goes onto the handpiece that are already being utilized for restorative dentistry. So this would be like an additional cost, additional maintenance for the office. We'll talk a minute about infection control. As I mentioned in the first lecture, coronal polishing is an aerosol generating procedure. And so again, those are those invisible moisture or liquid or particle pieces that kind of float in the air. And then I'm sorry, coronal polishing also can produce spatter or splatter. And so again, airborne particles that can be seen, and they can like kind of land all over people or objects. And so definitely this is just something you want to be mindful of. I think that, product improvement can kind of help with some of this. As years go on, we notice that with the current coronal polishing, it does spatter less, so you don't see as much of like the polishing paste like get all over the patient's face or all over the bib or whatever. And so I think that as products improve, this might decrease a little bit, but it's still always a problem and present. So you need to be mindful of that. Make sure that you're wiping down all of the surfaces, which I'm sure that you guys are all really great at that. But just keep in mind. And I think that the range in which aerosols goes is estimated to be about 10 feet, which is pretty big. So if you work in like an open bay style of office, I think about like ortho when I'm thinking that, then this could, be something that you really want to pay attention to. A little bit more about infection control. It's really, really, really important that you know that the handpiece itself needs to be sterilized in between each patient. And so I remember when I first got out into practice, the thought was if you just take off the prophy angle and that gets disposed, then you can just wipe down the handpiece itself and then you're good to go. But that is in fact not what the laws are related to this. So it's really important that you're making sure that you sterilize those handpieces in between each patient. And if you're not doing it now already, then start doing it now so that you don't get in trouble. PPE, of course, it's important again because this is aerosol generating procedure that you're wearing the appropriate mask. For aerosol generating procedures, that would require a level 3 or an N95 mask. I'm sick of wearing N95s. I don't know about you all. So a level 3 is just fine for me. They're less stiff, but Either one is totally appropriate. You should also have a gown and gloves and mask and glasses. And then it's also a great idea for you to have your patients be wearing glasses. So if you're not in the habit of that, especially when you are coronal polishing, it's great because of that splatter kind of flying up all over their face. If you haven't seen it before, I've seen it plenty where you can kind of just see it all over their face. So wearing glasses is a great idea for the patient as well. Um, as far as something that kind of plays into ergonomics is you want to hold this handpiece with a modified pin grasp. So that's your thumb and your first finger kind of resting in the same position on the handpiece, and then your middle finger resting right alongside of it. So all three of those fingers should be touching the handpiece at all times. Then your ring finger is your fulcrum. And so I will say that's probably like the one of the number one things that I see that's like an error when we go to start practicing is most people want to use the pinky as the fulcrum, but really remember that it is your ring finger that should be acting as the fulcrum. So even this picture kind of doesn't quite show it exactly right, because it really should be that ring finger that is providing the fulcrum. As we kind of talked about in the ergonomics lecture too, you really want to make sure you're moving that hand and wrist, as one unit together, to give yourself, the best chance of having good ergonomics. And when you're holding onto that, you really just want to lay that hand piece back right in between your thumb and your first finger and just like let it rest there. If you have an office set up where like the bracket table goes over the patient's chest and then the tubes kind of go over the bracket table, those are really nice because you're not having to fight with a cord that's kind of hanging off down by your side. And so things like that can help to decrease the fatigue that you might experience on your hands. Again, you want to have that neutral wrist position. You've already seen this top picture before in a previous lecture. So you want to have nice straight wrist position and that handshake position. You want to find a fulcrum utilizing your ring finger. This can be an internal or an external fulcrum. It does not matter. I find it to be a little bit easier if you fulcrum on the arch in which you're working. That way, if your patient closes or turns their head or whatever, you kind of go with the head movement. And so that can just help you be a little bit safer, a little bit more controlled, I guess. But it's okay to use an external fulcrum, kind of like how this first patient is like using the chin to kind of rest their hands on. Might also have a fulcrum potentially up here, but it kind of looks to me like they're using the chin as a fulcrum. Whereas down here, they're really fulcruming on those mandibular anteriors. All right, so as we get started with our actual technique, and we are going to, of course, review this when we're in the lab because I think that that's beneficial to kind of see it in person and like watch it and hear it like in real time, but we'll discuss it here. You do want to scoop up some paste into your Profi cup. And then if you have watched anybody polish from like a long time ago, you'll see that they kind of like swipe on each tooth, like 3 or 4 teeth, and then they go back and then they start to polish. With the products that we have now that are available, that's just not really needed. There's more abrasives and more like binding materials to help keep everything together. And also with the ribs inside the Profi cup, it kind of holds that paste in place a little bit better. So that's not really necessary anymore. So you'll just like scoop it up into the cup, and then you will come over and we're going to start at the gingival margin. And so you can see right here, the bottom of that cup is right there at that gingival margin. You're going to apply a little bit of pressure to get that cup to just like flare up against the tooth a little bit. And then we're going to do like a pat and wipe stroke, which you'll see here or we'll discuss here in just a second. Again, light to moderate pressure is okay. You just want to see that cup kind of flare a little bit. And as we discussed in a previous lecture, we really want the handpiece to be set at 10,000 RPMs or lower, which is easier to do with an electric handpiece. But with that air driven, you really got to listen as you press the rheostat. You can't be like pedal to the metal. Otherwise, you could be at, 30 or 40,000 RPMs pretty quickly. So you want to be mindful of that. You want to hear like a low, like whir noise, like a slow speed, as opposed to a high pitch, like ring, that you would hear when your doctor is using a high-speed handpiece. So as I was talking, we're gonna do like pat and wipe strokes. So we're gonna start at that gingival margin. We're gonna apply a little bit of pressure, let that cup flare. So we're gonna pat and then wipe up towards the occlusal, or wipe down towards the occlusal, depending on if we're in the maxillary mandibular arch. Each stroke should only be 1 to 2 seconds. So as we discussed, we don't want to leave it on the tooth for too long, or with too much pressure, or with too high a speed, because it can be like a heat generating procedure, and that can cause damage to the pulp. So we don't want to do that. So 1 to 2 seconds for each stroke is ideal. And again, we're going from the gingival area to the incisal or occlusal 1/3. Each stroke, we're going to remove that rubber cup away from the tooth and then readapt it and continue on with the next stroke. So as we talked at the very beginning, the teeth have all of these little contours that we have to work around, and we have to really get in next to those contacts. And so in these pictures, I'm hoping to helping you to visualize how we're really going to hug into the distal and get all the way up against that contact, pat and wipe up towards the occlusal. We're going to come over here to this direct buccal side again, pat and wipe up to the occlusal. Then we're going to hug into that mesial all the way into that contact and pat and wipe all the way up to the occlusal. Again, it is important to hold a fulcrum your whole time. You need to have a fulcrum. That's going to help provide some stability and also help your hand not to get so fatigued. And so it doesn't really matter where you put your fulcrum, but oftentimes it's nice if you can kind of pick one spot and stick there. And so in that case, kind of fulcruming on those anteriors and kind of stretching your fingers out a little bit to get to the posteriors might help you to enable like rotating around your fulcrum so you're not having to pick it up and move it around quite as much. So the sequence itself does not really matter. You can do whatever sequence it is that you want. The one that I am demonstrating here in the next few slides, you're going to start on the mandibular linguals. And the one benefit for doing it this way is that, as we've already talked about, lots of flavors and smells, and those things will really get the saliva juices flowing. And so obviously the mandibular linguals are going to be where most of the saliva is going to be anyways. So when they then start to smell and taste the flavors, that saliva is going to increase. And so it's going to be just a sloppy mess down there. And as Miss Kissel always says, you might have that like saliva lasso that just like flings all around the polishing angle. And that's gross. We don't want to have to deal with that. So start with the mandibular and mandibular linguals. Give yourself the best possibility of not having excess saliva flinging all around your prophy cup. Then maybe rotate outside to the mandibular buccals, work your way all the way around that arch. Again, make sure you have a fulcrum, whether it be on a tooth, an external fulcrum, or even fulcruming on your own finger. That's an option as well. And then we'll go up to your maxillary buccals, and then we will finish on the maxillary linguals. For coronal polishing, you can use direct vision anywhere that's possible. So anywhere that you can ergonomically and safely visualize the surfaces of the teeth, then you are more than welcome to use direct vision. So that might require you to have your patient look away from you or turn towards you. It might require on those maxillaries, you sit down in front of the patient, either at 7 o'clock for the right-handed people, or like 5 o'clock for the left-handed people, and have your patient turn towards you, whichever direction. And then you can maybe do your dominant linguals and then have them look away from you, and then you can do your non-dominant linguals. But really, I can never do like canine to canine linguals on the maxillary without using indirect vision. So that's like the one spot where me personally, I really just need to use my mirror. It's not a requirement. If you can see everything and you can do it ergonomically, then you can do it with direct vision everywhere. But for me personally, I just can't do those 6 little teeth on the linguals without using my mirror. It's not required that you polish the occlusals, but if there's a lot of heavy stain or plaque, like a tooth does not occlude with another tooth, then oftentimes there's tons of plaque that builds up into those occlusal surfaces. That would be a great time to get in there with a like tapered polishing brush, similar to this like tealish one here, because that can really remove a lot of plaque. Sometimes it can also remove some stain, depends on if you can kind of get into those nooks and crannies because it's a little bit challenging. So polishing those occlusal surfaces as needed is good. And then want to rinse as we go along. So it's up to you, or maybe you can kind of feel it out with each patient to determine when might be a good time to rinse. For me, I usually do like a whole arch before I rinse, and then I'll go up and I'll do the whole other arch, and then I'll rinse, and then I give them like one more good rinse at the very end. So that's just what I choose to do. It tends to work out pretty, fine. Like nobody normally, says anything. So that tends to work for me. So you just find out whatever works for you, and as long as it's working for your patients, then you're good. Okay, so just to kind of summarize all of the things, it is important to make sure that you evaluate the patient's need for polishing. So we talked about, the potential to do selective polishing if the patient has areas of concern, demineralization, caries, inflammation of the tissues, or if they have restorations or newly erupted teeth or implant bodies that just don't need or wouldn't benefit from polishing, then you'll just skip those. Um, and then make sure that you select the appropriate grit, preferably fine, but if you need that coarse, that's okay. Make sure that you use the appropriate pressure and the appropriate speed as you are going around and corona polishing. So this concludes number 3. You just have one more left. I'll see you in a bit.